we'll start CPR on him, okay? I'm going to tell you what to do.
Okay.
Okay? Are you right next to him?
Yeah.
Okay, put him flat on the floor on his back.
Okay.
Expose his chest.
Expose his chest.
Kneel by his side.
Okay.
Okay. Put the heel of your hand in the center of his chest, right between the nipples.
Okay.
Push down firmly with only the heels of your hands, 2 inches.
Okay.
Welcome to CPRfundraising.com. In this video lesson, you'll learn how to properly perform adult CPR for the single rescuer. In previous video lessons, you learned the emergency action steps and preventing disease transmission through the proper use of personal protective equipment such as rubber or latex gloves and breathing barriers. In this training video, we will assume that you have completed the emergency action steps of check and call. You will now provide care for an unresponsive adult showing no signs of breathing. Are you ready? Let's get started. Cardiopulmonary resuscitation, also known as CPR, is an emergency procedure performed to manually preserve intact brain function until advanced medical care can restore circulation and breathing for a person in cardiac arrest. CPR is performed when victims are unresponsive and are not breathing or not breathing normally, such as agonal, gasping respirations. CPR is performed by completing 30 fast and hard chest compressions that are at least 2 inches deep at a rate of at least 100 per minute in an effort to create artificial blood circulation by compressing the heart. 2 rescue breaths are given to the victim after each cycle of 30 fast and hard chest compressions. CPR can be administered to adults, children, and infants. ABC stands for airway, breathing, and circulation. Let's look at how to properly perform CPR for the lay rescuer. Place the victim on their back on a firm surface. Never attempt CPR if the victim is not on a firm surface. Mattress or cushion displacement occurs with each compression, making circulation efforts ineffective. Position yourself next to the victim's chest and shoulders. Open the victim's airway. Use the head tilt chin lift technique to adjust the victim's head to a neutral position. This will open the airway. Place one hand on the victim's forehead and the other hand under their chin, like this. The victim's head is tilted back slightly to pull the tongue away from the back of the throat. Now look, listen, and feel for breathing for no more than 10 seconds. Place your ear next to the victim's mouth and nose like this. Look to see if the victim's chest rises and falls. Listen for normal, unlabored breath sounds. Agonal or gasping breaths are not considered normal breathing and should be considered as no breathing. Feel for the victim's breath on your ear. The victim is not breathing or is not breathing normally. This brings us to the B. The B stands for rescue breathing. A breathing barrier or mask like these is used to protect against disease transmission. Perform compression-only CPR if you are unwilling to perform rescue breathing. With the victim's airway open, put the breathing barrier over the victim's nose and mouth. Now pinch the nose shut and open the victim's mouth. With your mouth, form a seal over the victim's mouth and blow. Rescue breaths should be steady, firm, and take about 1 second to perform. Blow just hard enough to see the chest rise and no more. Then, release the nose and remove your mouth to allow the air to exit from the victim's lungs. Pause just long enough to take another normal breath. Give 2 rescue breaths. Watch for the victim's chest to rise with each breath. If the chest doesn't rise, readjust the victim's airway and try again. Each breath should last about 1 second. You should only attempt 2 rescue breaths before continuing with chest compressions. Avoid blowing too hard, as it is possible for air to be forced into the victim's stomach. If the victim's stomach begins to get bigger, you are blowing too hard. This is known as gastric distension and could cause stomach contents to be belched out unexpectedly and enter the victim's lungs. This brings us to circulation. In CPR, circulation is achieved by performing chest compressions. To perform chest compressions, place the heel of one hand over the center of the victim's chest, between the nipples, like this. Keep your fingers up and off the victim's chest. Place your other hand on top of the first hand and interlock your fingers so that the hands are overlapped and parallel. Keep your elbows straight and locked. Use your upper body weight and the muscles in your upper torso and hips to provide compression force, not the muscles in your arms. Do not perform compressions with your arms bent like this. In order to be effective, chest compressions must be at least 2 inches deep. Now position your shoulders so that they are directly over your hands. Compress the heart in a straight down and up motion at least 2 inches deep. After each compression, allow the chest to come all the way back up. Don't take your hands off the chest, just lift your weight off the chest. This is known as chest recoil, and it allows the heart to refill with as much blood as possible between compressions. Never compress the chest at an angle. This happens when your shoulders are not directly over your hands. CPR may cause injuries to the victim. You may hear cracking or popping sounds when performing CPR. This may be ribs breaking, the sternum cracking, or cartilage separating from bone. Quickly verify your hand position and that you are not compressing too deeply, but continue compressions. Do not stop unless you need to make a quick adjustment to your hand position. While performing compressions, it may be helpful to think of the songs "Staying Alive" or "Another One Bites the Dust," as they are both 100 beats per minute. Count each compression aloud as you complete it. This will help you keep track of where you are in the cycle and when you need to stop to provide rescue breaths. Once you have completed 30 fast and hard chest compressions at least 2 inches deep, you need to transition back to provide 2 rescue breaths. You will continue this cycle until the victim regains signs of life, another rescuer with equal or greater training arrives and takes over, you are too tired to continue, EMS arrives on scene and takes over, the scene becomes unsafe, or an AED arrives and is ready to be used. If an AED arrives on scene, continue compressions until it is set up and ready to use. Then immediately stop compressions and allow it to analyze the victim. So let's review. Place the victim on a hard surface. Kneel next to the victim's chest and head. Open the airway using the head tilt, chin lift technique. Look, listen, and feel for breathing for no more than 10 seconds. Place your hands between the nipples on the victim's chest. Place your other hand on top and interlace your fingers. Keep your elbows locked. Keep your shoulders directly over your hands. Perform 30 fast and hard chest compressions at least 2 inches deep. Give 2 rescue breaths, about 1 second each. That's it. That's all there is to it. On behalf of CPRfundraising.com, thanks for watching.